Hi, I am Dr. Om Prakash. I'm a practicing neurologist from Warangal. Balancing the equations, taking credibility for doing right and accepting responsibilities for doing wrong. Take accountability for your actions. We can take all the credits in the world for the things we do right, as long as we take responsibilities for the things we do wrong. It must be a balanced equation. Let me argue my point. I want to start with a story, a true story from 18th century. In the 18th century, there was something that spread across the Europe and eventually made its way to US, called Black Death of Childbed or puerperal fever. Basically, what was happening, women were giving birth and they would die within 48 hours of giving birth. This Black Death of childbed was the ravage of Europe, and it got worse and worse over the course of a century. In some hospitals, it was as high as 70% of women who gave birth would die as a result of giving birth. But this was the Renaissance. This was the time of empirical data and science. And we have thrown away the things like tradition and mysticism. These were men of science. These were doctors. And these doctors and men of science wanted to study and try to find out the reason for this Black Death of childbed. So they got to work studying. They would study the corpses of women who had died. In the morning, they would conduct autopsies, and in the afternoon, they would go and deliver babies and finish their rounds. And it was not until somewhere in the mid 1800s that Dr. Oliver Wendell Holmes, father of Supreme Court Justice, realized that all these doctors who were conducting autopsies in the morning were not washing their hands before they delivered babies in the afternoon. And he pointed out and said, "Guys, you are the problem." And they ignored him and called him crazy for 30 years. Until finally somebody realized that if they simply washed their hand, it would go away. And that exactly what happened when they started sterilizing their instruments and washing their hands. The Black Death of childbed disappeared. My point is, and the lesson learned is, sometime we are the problem. So take accountability for your action. We can take all the credits in the world for the things we do right, as long as we take responsibilities for the things we do wrong. It must be a balanced equation. We don't get it one way and not the other. We get to take credits when we also take accountability. A quote from Dalai Lama: "When we think everything is someone's fault, you will suffer a lot. When you realize that everything springs only from yourself, you will learn both peace and joy." Further adding to the story, I want to put forward a couple of case studies from our personal experience. Recently, on 22nd of August, I was summoned from Consumer Court regarding a LIC insurance related case. Usually, I used to be at my clinic around 11 o'clock, but that day I happened to be very late and I reached my clinic around 1:30 in the noon. soon as I entered the clinic, I was overwhelmed because my OPD was completely packed and the patient flow was very, very high, and that causes me a sense of anxiety and palpitation. So I started taking patient one by one, and I had to rush at a different pace than my usual speed. In mid of all this, there walked a patient with 3 or 4 attendants, adding more pressure to my hectic schedule. Let me present that case now. A 30-year-old male reached the clinic with the symptoms of right-sided facial weakness, which just started half an hour ago. The patient was not diabetic, not hypertensive, and there was no significant medical history. Her wife told me that he had similar weakness 2 days ago, which recovered in few minutes after taking salt water. I asked them to get MRI brain urgently because there was history of TIA-like symptoms 2 days ago. Patient presented himself within half an hour of the onset of symptoms, so well within the window period in case thrombolysis is required. To be very honest, I can't give more time as I was already running late. And hyper-anxious attendant, I didn't want to take any chance. With proper coordination, I was able to get the MRI brain within half an hour, and MRI was absolutely normal. The patient and the attendant were back to my chamber after some time. So very confidently, I have started explaining them about Bell's palsy. This is because of viral infection leading to facial nerve damage. This is known as Bell's palsy. There is absolutely nothing to worry about, and we have treatment for it, and you will be fine in a couple of weeks, and so on. I decided to give steroid, so I asked the patient to get the blood sugar done. After a while, one of my staff came and told me that patient vomited outside and became unsteady. I was confused. Why a Bell's palsy patient will have vomiting and unsteadiness of gait? So I decided to re-examine the patient. On re-examination, I discovered a right gaze palsy, which confirmed that we were actually dealing with stroke. But you can imagine a situation. Few minutes back, I was very confidently explaining about Bell's palsy, and now I'm explaining about stroke and trying to convince them about thrombolysis. Attendants were looking at each other and becoming more confused. Even though the 2 hours were passed from the initial onset of the symptom, but we still had a sufficient time to plan thrombolysis. And my team was available, so I called my team and asked them to thrombolize this case. Let me share the videos of that case.
పేరు
ప్రశాంత్ సార్.
ఈయన కళ్ళు మూసుకో. రైట్, కళ్ళు తెరువు. కళ్ళు గుడ్లు అటు ఇటు తిప్పు. ఇటు తిప్పు. ఇటువైపు కుడివైపు. లెఫ్ట్ సైడ్ తిరుగు. ఇట్లా రైట్ సైడ్ తిప్పు. ట్రై చెయ్యి. రావట్లేదు. పైకి కిందికి. రైట్ సైడ్ తిప్పు ఒకసారి. రైట్ ఇటు పక్కకి తిప్పట్లేదు. రైట్, ఓకే ప్రశాంత్. చక్రవర్తి రాజగోపాలాచార్యను.
చక్రవర్తి రాజగోపాలాచారి.
ఈయను. రైట్, ఓకే ప్రశాంత్.
And this was 20 minutes after the thrombolysis.
నీ పేరు?
ప్రశాంత్ సార్.
ఈయన. కళ్ళు తిప్పు. అటు తిప్పు. ఇటు తిప్పు. అటు తిప్పు. రైట్ సైడ్ తిప్పు. రైట్ సైడ్. పైకి కిందికి. ఓకే అమ్మా.
And this is a follow-up photograph after 10 days, and he was absolutely fine. So we are not here to boast ourselves that we have done something great, we have thrombolyzed the patient become normal. No. The point which I want to bring here, that I was able to skip from misdiagnosing a stroke for Bell's palsy. And this was not because of my poor clinical acumen. Sometimes it is the clinical stage of the disease. Sometimes the disease may be in the evolving stage. So it's all depends that at what stage you are seeing the patient. And the second thing, because of the teamwork, I was able to do justice to this patient despite of a hectic schedule. So teamwork pays off. You cannot escape the responsibility of tomorrow by evading it today. A quote from Abraham Lincoln. Let me present the second case. A 40-year female patient presented with complaints of headache and blurring of vision for 1 month, which was progressive in nature, and there was no history of any other relevant medical history. She was carrying a CT scan report, which was normal, and an ophthalmologist's prescription reported as questionable papilledema. So patient was admitted for headache and papilledema. We did MRI brain and MRI venography, which showed right transverse sinus thrombosis. So treatment was started with anticoagulant and anti-edema measure. Her headache subsided in 1 day, but her visual complaints were persisting. I attributed her headache and papilledema to cortical vein thrombosis. We took the ophthalmologist's opinion, and there was a very severe papilledema and also a very significant visual field defect. One of our team members raised a question that her symptom and sign are disproportional to the thrombosis on MR venography. So are we missing anything? Because of our conflict of opinion, we have decided to go for CSF pressure measurement, for which I was little bit reluctant because it's an invasive process and we were already having a diagnosis of venous thrombosis, which can explain her clinical presentation. But we have repeated the MRI venography before that, and which came normal. Then we measure the CSF pressure and it came to be 28 centimeter of water, and we drain little bit of CSF, and here is the video after her CSF drainage.
ఏం పేరు నీ పేరు? ఎన్ని ఇవి? ఇదే కలరు? గ్రీన్ కలర్. ఓకే గుడ్. ఇప్పుడు కన్ను మార్చు. ఇవన్నీ నా చేతికి ఏముంది? నా షర్ట్ కలర్ ఏంటి? ఓకే రైట్, క్రీమ్ వైట్. ఇక్కడ ఎన్నో బెడ్ నెంబర్ ఉంది అక్కడ? ఓ అది కూడా క్లియర్ కనబడుతుందా? ఇప్పుడు ఎట్లున్నావు అప్పటికి ఇప్పటికి చూపు? నేను మళ్ళీ అడుగుతున్నా, నాకు తగ్గకపోయినా పర్లేదు, పెరిగిందా వచ్చినప్పటికి ఇప్పటికి? పెరగలేదు. తగ్గుతుందా? ఇంప్రూవ్ అవుతుందా? ఇంప్రూవ్ అవుతుంది. ఇంప్రూవ్ అయింది. వెరీ గుడ్ అమ్మా. సరే అయితే పడుకో. రైట్.
We also took the opinion for optic nerve fenestration, and they said it is not required at present and they need to follow up after 3 months. So the point is, the conflict of opinion leads to reinvestigation, and hence I was able to correct my diagnosis to idiopathic intracranial hypertension from cortical vein thrombosis. And because of the team, I felt that I become more accountable for my clinical decisions. And the third very important point is MRI is not always a final diagnosis. The MRI venography was first showing a cortical vein thrombosis, and after 3 days when we repeated, it came normal. And in the first case also, the MRI was completely normal, but it was the clinical sign which helped us to clinch the diagnosis and timely management of the patient. Thank you.